my first general set of values in dentistry is treat everybody like it's your mother or your daughter. I think that's the first thing we do. In the end, patients come to us seeking advice without knowledge of what is really correct or not correct. And it's up to us to give them the correct advice. And for that, we need honesty. And I believe I follow that dictum very closely. When we treat patients, we have to think about it. And I often use analogy of a car. It's no good having two good tires if the other two tires don't work, because the car's not going to work. So we need to think of how we're going to make a functional unit of something. So sometimes we have to make certain decisions based on certain things that might not be quite exactly how we look at each tooth by tooth, but to give that patient the full advantage of getting something that they're going to get a benefit from long term, not short term. We have to think long term. And long term, unfortunately, today could be much longer than we realize because of the age that people are living. And we're seeing younger and younger patients with more decayed and or broken down mouths, especially due to drug abuse and alcohol abuse. And so we have to be aware of the fact that this might not be their last go around. And whatever we do for them, they might be back. If somebody has a knee replacement or a hip replacement, you'll often hear patients being talked, they're going to go in for a revision. What we are doing is we take, in implants, we take a biological medical device and try and replace a tooth with it. So it's a replacement, and we have to think about it that way, and therefore think about the alternatives if this maybe at somewhere down the line has to be replaced.